Hello, I'm Helen Normoyle, and I'm joined today by Dr. Clare Spencer, and we're the co-founders of my Menopause Centre. Now, October is Breast Cancer Awareness Month, and so many women that we know will have experienced breast cancer in some form over their lives. So in today's conversation, we're going to actually start off by talking about breast tenderness, because you might not be aware that around 4 in 10 women will experience some form of breast tenderness as they go through the menopause. So Claire, maybe let's start with that. Why do some women experience breast tenderness as they age or as they start to go through the menopause?
Yes, hi, thanks, Helen. So it is a common symptom, as you say, of the menopause transition, and it's got to do with the fluctuation of hormones. So as estrogen and progesterone levels change in your body as you go through that menopause transition, our breasts are and can be incredibly sensitive to hormone swings, to increases in hormones. And so it causes a lot of anxiety, as you can imagine, but breast tenderness is really common.
And then obviously, if you are one of the women who experience breast tenderness, you might be concerned that this is a symptom or a sign of breast cancer. So Claire, can we just talk about maybe some of the signs and symptoms of breast cancer? I know we've got an illustration that we can maybe use to help with this.
Breast tenderness can be concerning for some women. Obviously, it causes a lot of anxiety, as any change in our breast naturally does. And if you are experiencing breast tenderness, it's definitely worth getting your breast checked out by your GP, but it's actually not a common presenting symptom of breast cancer. The symptoms and signs really to look out for are any breast lumps, however small and however insignificant you feel that it might be, get it checked out. If there's breast swelling, if you're looking in the mirror and there's difference in the breast sizes, difference in your breast contour, any changes like that. For example, skin dimpling also is something that would be important to raise with your doctor. If you check your armpits fairly regularly for lumps and bumps, that would be important to get checked out if you feel anything different. And then changes in your nipples. So any bloody discharge, if your nipples are suddenly inverted or gradually start to invert, that's where the nipples actually turned in rather than turned out. Any other skin changes, so any changes in colour, any inflammation or redness, or any rashes, particularly around the nipple and the area around it, the areola, can be significant. So have a look at our diagram, and really any changes that you notice, I would urge you to go and see your GP about it.
Thank you, Claire. That's very helpful. And I think also particularly reassuring to know that breast tenderness isn't a common presenting symptom of breast cancer. So thank you so much for clarifying that. Now, one of the questions I know that we get a lot in our workshops, and I'm sure that you get a lot from the patients that you see, is can you take HRT if there is a history of breast cancer in your family?
This is a really important point to call out, because not all family history of breast cancer will be significant. For example, the age of the family member, how many family members they were, and whether they were male or female is really important. Whether one breast was involved or whether there was bilateral breast cancer. For example, if it's just a single grandparent who had breast cancer in older age, that's really not likely to significantly impact on your risk. If your mum had breast cancer and she was diagnosed over the age of 40, that's unlikely to have a significant impact on you. But actually, if your mum was diagnosed when she was under the age of 40, that is likely to have a significant impact. So again, I would urge you to go and have a discussion with your GP. Many areas in the country will have a family history of breast cancer clinic, where they can look at your exact family history and from that be able to advise you of the impact on your own personal baseline risk of breast cancer.
Great, thanks Claire, very clear advice there. And then obviously many people, many women who have had breast cancer themselves will be asking themselves, can they take HRT or not? So what is your, and I'm sure there isn't a straight yes or no, but what would your advice be to women who are asking themselves that question?
That's a great question. And unfortunately, there isn't a straight answer. So we know that HRT is likely to increase your risk of breast cancer by a small amount. If you've had breast cancer already, the evidence about how and if it increases your risk of recurrence, unfortunately, is still not completely clear. There were 3 trials that were set up to try and answer that question, but 2 of them were stopped early in the process because one of them showed that it did look like there was a significant increased risk of recurrence of breast cancer. When they put all of the results for all 3 trials together, actually there wasn't a significant increase in risk of recurrence. But like many things in medicine, it will boil down to the individual as to what type of breast cancer, what stage of breast cancer, how aggressive it was. It's really an individual decision. Some women who've had breast cancer will feel too anxious to take HRT. Some women will have such horrible, debilitating menopause symptoms that they feel that they would really like that discussion. So my advice would be to really ask for a referral to a menopause specialist, speak to your oncologist, so the cancer specialist looking after you, speak to your breast surgeon as well. And it's really putting opinions together and making a really personal decision for you. So not a clear answer, I know, but a discussion worth having.
Yeah, and I think that in itself would probably come as a surprise to many women because they will have assumed that it would be a categoric no, that they can't. And so for women who can't have HRT, if that is the advice, are there any alternatives then? And they are experiencing menopause symptoms. What alternatives can they look to support them and to help them take control of their symptoms?
Yeah, so the great thing is that there are lots of alternatives. So like anybody going through the menopause transition and experiencing symptoms, look at your lifestyle factors. Is there anything that you could do to just try and take the edge off symptoms? So for example, addressing alcohol, addressing smoking can help take the edge off hot flushes. Look at caffeine, look at your diet. There's really good evidence that cognitive behavioral therapy can be really beneficial in helping managing the physical as well as psychological symptoms of the menopause. There are some really good trials that were carried out showing that, I know it sounds counterintuitive, but talking therapies can help your experience of physical symptoms. And that's not saying that you're imagining the hot flushes in the slightest. It's just changing your thought process can really diminish the severity of hot flushes, night sweats, as well as other symptoms. And then there's medication that your GP or menopause specialist can prescribe that can again help take the edge off symptoms. So for example, clonidine is actually a blood pressure tablet that's licensed for hot flushes. There are plenty of other types of medication that aren't licensed for the purpose of managing menopause symptoms, but there's good evidence that they can help. The commonly prescribed antidepressants, I know a lot of women don't want to reach for an antidepressant, understandably, but they can just take the edge off hot flushes enough to get you through the night, can help with the horrible anxiety and low mood that you can get going through the menopause. In terms of vaginal symptoms as well, even if you've had breast cancer, many women can still use a vaginal estrogen. Again, it needs a discussion for your particular circumstances, but you may be able to use a vaginal estrogen. If you don't feel comfortable or you've been advised not to, then there are plenty of non-hormonal options like vaginal moisturizers, vaginal lubricants that you can use that don't contain hormones, but can really be helpful to symptoms. So the take-home message is lots of options. We've got information on our website, and definitely don't suffer in silence. There will be something that can help. Yeah.
Claire, that's great, and it's great to hear that there are a whole range of things that you can do, even if you can't take HRT. And not to put you on the spot, but can you remember the name of the book. I know there's a great book that you recommend around using cognitive behavioral therapy as you're going through the menopause. Fantastic. I think you're just reaching for it. Is that where you're going to flash up and show us?
So here's one I prepared earlier. I've just got it here. It's Managing Hot Flushes and Night Sweats. I don't know if you can see that. It's by Professor Myra Hunter and Melanie Smith. And it's excellent. It's got lots of information. It's really straightforward, and it takes you through the process of cognitive behavioral therapy. There are some free sheets available as well on the Women's Health Concern website, which they're slightly briefer, but they'll take you similarly through that process of what CBT is and how it can help you.
Brilliant. And CBT is obviously a great tool for life anyway. It can help with so many different situations, but who would have thought that it can help with hot flushes and night sweats as well? Now, one last question then. We get a lot of questions around if lubricants are going to help me. Do you have any brands in particular that you would recommend? And while normally we don't go down the route of brand endorsement, I know there are a couple of brands in particular that you know are really good and of very good quality.
Yes, so many yeses, but the Yes brand of lubricants and vaginal moisturizers can be particularly helpful. They were designed by women for women. There's a moisturizer, there's water-based lube, there's an oil-based one as well. So I would recommend. The other brand that can be helpful is the Silk brand. Lots of women tell me they like that also. Yeah, there will be many more, but they are the particular ones that we've found helpful.
Yeah, brilliant. Thank you. Well, Claire, thank you so much for that. Incredibly informative as ever. And thank you very much for joining us. We have lots of information on our website around breast tenderness, around vaginal dryness and irritation, around HRT. So visit us on www.mymenopausecentre.com. Thank you.